Hello, I'm Cynthia Nickerson. I'm your host. Welcome to the program. I'm at the offices of the Pink Ribbons Project in Houston. Pink Ribbons is an organization that uses the arts to save lives and improve the quality of lives for those touched by breast cancer. And thanks to the generous funding of Pink Ribbons, we're able to bring you this program. And joining me now is Dr. Jenny Bennett, a 14-year breast cancer survivor and really the driving force behind this program. Dr. Bennett, why did you feel it necessary to organize this television show?
I felt it necessary for us to do this program to help reduce the high mortality rate of breast cancer in the African American community.
And that mortality rate is indeed very high, and we're going to talk to some of the experts about that very reason, as well as hear testimony from survivors who are anxious to share their stories.
The 30 minutes that you spend today watching this show may save your life or the life of someone else you know.
So sit back, relax, and join us.
Surely goodness and mercy shall follow me all the days of my life, and I will dwell.
And one day I took a shower, and I felt this lump in my right breast, and I went, oh my God. I got hysterical, and I thought maybe that I was just feeling something that really wasn't there. So I laid on my back and I did the regular examination, and sure enough, there was a lump there.
How say ye to my soul, flee as a...
Lucy Joseph, diagnosed with breast cancer at age 46.
So in the beginning, I planned my funeral. I planned where's my daughter gonna live and what am I gonna do and how far is it, you know. So I was very scared in the beginning.
Because cancer runs in my family. My dad died from cancer. Both of my grandparents died from cancer and an uncle. And I'm the first one to have breast cancer.
May the good Lord bless you. May the...
Just a person that loved to swim a lot, so I'm the one that kind of noticed a little different in my breasts at the time. So had a mammogram done, and they said they wanted to go to, they wanted to do like a regular ultrasound on my breasts just to make sure everything was okay. But when they did ultrasound, they spotted something was like a little mass there.
Linnell Daggs, diagnosed with breast cancer at age 38.
No, I never understood about breast cancer at all because no one in my family had breast cancer. So it was like when I first found out I had cancer, I thought I was going to die. It really affected my children really mentally because they thought I was going to die.
Basically, before I felt the lump in my breast and I went to a doctor, I felt the lump in my breast and went to a doctor, and they were like, no, you're basically too young. This is fibrocystic disease. You're too young.
Lisa McMillan, diagnosed with breast cancer at age 26.
And of course, fear did come, and I was afraid, and basically just began to pray and stand on the promises in the Word, and that's where my strength came from.
Breast cancer is the most common cancer among African American women and the second leading cause of cancer deaths among Black women, behind lung cancer.
African American women tend to have less breast cancer when compared with white women. But the unfortunate news is that once African American women get breast cancer, they tend to die of breast cancer. And part of the problem is that women, African American women, get breast cancer at an earlier age. When you look at women less than 40 who are diagnosed with breast cancer, most of them are African American women.
Tracy Harrell's family history includes several women with breast cancer. Tracy was diagnosed at age 40.
Plus I'm triple negative, so I have that double whammy, the genetics and being triple negative.
Triple negative breast cancer means that the estrogen receptor is negative, the progesterone receptor is negative, and the HER2/neu receptor is negative. And that knocks out several classes of drugs that we could use for adjuvant therapy, which means additional therapy.
Health experts are calling breast cancer in African American women a public health crisis.
Well, we know there's some genetic link. For African women, there are regions within Africa in which the incidence of premenopausal breast cancer is 50% or more.
Dr. Lovell Jones, a minority health expert at MD Anderson Cancer Center, suggests African American women need to start taking preventive action at a younger age.
One of the risk factors, at least for early occurrence, is being Black, including that in that equation. and knowing that the age of onset is 10 years earlier to an extent. And so all those guidelines that are out there set and tell you that you need to be screened by 50 as the baseline. I would move it back to 40 or even 35. Knowing that African American women do have an early age of onset, you have to weigh that with the fact that having it at an early age of onset, both being young and being black, raises your risk of having a more aggressive disease. And then weighing the fact that having a more aggressive disease means that you have a shorter time to really intervene where your life is concerned.
These women admit upon diagnosis they were worried about their lives, but now, as survivors, their sense of hope returns.
I believe that I am a miracle, because had I not did the self-examination myself, then it could have went into another stage.
And it's about your spirit, it's about your faith and how you feel about yourself. If you're going to speak it, you're going to receive it. So I spoke it every time. I'm going to live, I'm going to beat breast cancer.
Just because you have cancer doesn't mean that you're going to die.
Well, Dr. Bennett, one of the main messages that we're emphasizing throughout this program is early detection. How did you find your cancer? Did you find a lump?
No, I didn't find a lump. I had several tests done based upon a nipple discharge that I had. I had a mammogram, an ultrasound. I also had a test called galactogram, and then the final diagnostic procedure was a biopsy. And through those screening and diagnostic procedures, it was determined that I had breast cancer in my left breast.
Well, you heard Dr. Bennett mention ultrasound. Coming up, we're going to introduce you to an expert in the field of diagnosing breast cancer using ultrasound. But first, how does cancer happen? Many of you may wonder, are there any signs or symptoms to look for? Well, here are known risk factors for breast cancer. Breast cancer occurs when cells in the breast become abnormal and start randomly dividing. These cells form too much tissue and become a tumor. Signs and symptoms of breast cancer are lump in the breast or underarm, thickening or swelling of part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple or breast area, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk, any change in the size or shape of the breast, unusual pain in any area of the breast. Risk factors for breast cancer are age. While most breast cancer is diagnosed in women over 50, African American women are increasingly being diagnosed significantly earlier. Family history. About 5 to 10% of breast cancer cases are thought to be hereditary. Lack of physical activity, obesity, drinking more than 1 alcoholic beverage a day, starting menstruation before age 12, starting menopause after age 55, having no children or having a first child after age 30, long-term use of birth control pills, long-term use of hormone replacement therapy. But keep in mind, a woman could have none of these risk factors and still get breast cancer.
The biggest risk factor is the fact that you're a woman. The most important thing as a female is to know your body, know and understand the changes that take place within your breast so that you can communicate to your primary health physician what's important, what changes have been made, and if you notice any differences. And if you do, whether they be minor or major, let your physician know.
So how do you do breast self-awareness? Well, here's an expert.
Hi, I'm Velma Watson. I'm one of the mammogram case managers here in Houston. I work for an organization also here in Houston. What I'd like to do today is to teach you how to do self-breast examination. The first thing I would like to show you is how to examine the breast if you're in an upright position. You would take your hands and you would feel around your clavicle, all around your collarbone. And you would just feel around in that area, mash down in between the collarbone and press kind of firmly to see if you feel any nodules or knots in that area. Also, you want to come and you want to take your hand and you want to feel down the chest, Also to see if you feel any knots or nodules. Once you have finished that, then you're going to come and you're going to press firmly all the way around your breast with the pads of your fingers, not your fingernails, but the pads of your fingers, and you're going to go in a circular motion, not raising your hands up all the way around. One good way to do this is to put lotion on your hands and on your breast, or you can do it with soap in the shower. The same way that you would do this in an upright position is the same way that you would do this in the shower. You would, in the shower, or either laying down, you will put your hand behind your head and you will just go around your breast in a circular motion. If you're doing this laying down, you will put a pillow behind the shoulder and make your breast kind of come upward, and that way you can feel any nodules or anything behind your, inside your breast. You want to press enough so that you can feel everything in your breast. Some women have what they call fibrocystic breasts, which are lumpy breasts. And that, for that very reason, is why we express to the women to do self-breast examinations, because you're going to get used to your breast, you're going to get used to those nodules that you're feeling in your breast, which are probably not anything, but you'll get familiar. So when you do go to your doctor once a year to get your clinical breast exam, then you can tell him if there's something different that's going on.
Dr. Elise Cook also gives instructions in her role as Associate Professor, Clinical Cancer Prevention at MD Anderson Cancer Center.
If you like to cover it in a circle, that's fine. If you like the grid format, that's okay too. And just try to cover it twice, and then examine under your arms and feel for any lumps under your arms. Get to know your breasts. Starting at the age of 20, it's recommended that you have a clinical breast examination, an examination by your doctor at least every 3 years. Starting at age 40, then you have a clinical breast examination along with your mammogram every year. And that can increase the yield of picking up breast cancer along with the mammogram starting at 40.
During a mammogram, a technician places your breasts on a flat surface connected to a larger device that goes up and down and side to side to fit a woman's body.
This is the compression paddle. It comes down. This is the most scary part, of course. But it's just, the point is to be tight, not to be where the patient can't handle it or tolerate it. It just comes down. And I always tell them it should be tight, but it shouldn't be unbearable. You know, if so, then we can adjust things, because every woman's breast is different. You know, some are more sensitive than others.
The surface where the breast is placed is a bit cold, and the patient feels slight pressure during the procedure, but it's over within minutes. And this is what the radiologist sees.
First, if there's an abnormality on mammography and it looks like there's a mass on mammography, then our next step after we've done further evaluation of that with additional mammographic views is often to do a sonogram or an ultrasound. And we can further characterize the mass, look at the margins, and also under ultrasound we can biopsy the lesion.
This is an ultrasound image of a breast.
If you were looking for a breast tumor, you'd look in this area in the breast parenchyma. Many of the ultrasounds that we will do for so-called problem solving, where there may have been a palpable abnormality, something that the patient or the doctor felt, or sometimes for a mammographic abnormality, something seen on mammography, when we go to the ultrasound, we can really work those up and indicate with further looks, with ultrasound, with a different way of looking, that this was just breast parenchyma, breast tissue, that there really is not an abnormality.
While screening technology is constantly improving, which increases the chances of early detection, health experts agree the challenge is finding ways to make sure all women are getting the message and acting on it.
Certainly, if everybody who was eligible to get screened got screened, we would cut down on the number of deaths from breast cancer. There's no question about that.
Well, it's important as well as encouraging to know that if detected early, breast cancer does have a 98% survival rate. Well, what comes after detection? Treatment.
The treatment that I had was a mastectomy, and following that mastectomy, immediately following, was reconstructive surgery. Each woman has a different plan of action for her diagnosis. Just like each woman is different, each plan is different.
Basically, I ended up having a modified radical mastectomy, and this was suggested or urged from my physicians because my mother had ovarian cancer. My grandmother had breast cancer, but she didn't die of that. And there was also other family members with cancer. They were fine, but that was in my family line, and they were concerned. And so I opted for that. I'm thinking now, that was in '87, maybe I probably would have gone with a lumpectomy today. But ended up having reconstruction afterwards.
That may very well have happened if Lisa was diagnosed today.
Sometimes we have this misconception that really removing the entire breast is necessarily better. So the more that is taken out, the better it's going to be for me. That's not necessarily the case. So that's why nowadays, if the patient is a candidate for breast conservation, if we can actually do a lumpectomy and save the patient's breast, that's what we choose to, and that's what actually will be recommended.
The size and type of tumor play a role in determining the treatment.
So there are many cases in which the patient will require only surgery or surgery plus radiation. Usually the earlier the diagnosis, the likelihood is that the patient will only require either surgery or surgery plus radiation. So more advanced stages like this one, like stage 3, all these patients will require surgery, they will require radiation therapy, and they will require chemotherapy in most cases. Some of them, depending if they are being diagnosed with cancer that is hormone sensitive, then they will also require hormonal therapy.
Lucy Joseph is on hormonal therapy. She takes pills called tamoxifen to fight cancer cells.
Because I think the pills make me very fatigued and very tired, but it's something that they said it wasn't intense enough for me to take chemotherapy or radiation, so that I need to take the cancer pills, which is better than chemotherapy and radiation.
The various types of chemotherapy have come a long way in recent years. Tracy Harrell is fighting her second bout with cancer. She compares her own treatment to her mother's 29 years ago.
My mom, when she was treated, she had chemo for 1 year, once a week. So the dosage was very small, but it was just tedious because it was once a week for 12 months, where my dosage is probably 10 times as strong as her dosage. So the first time I was 6 months, and I was able to complete that actually in 4 months because my body was able to tolerate the chemotherapy, and I was a healthy person.
So most patients will have somewhere from 4 to 6 months of treatment. Most chemotherapy nowadays can be well tolerated. Okay, some of them will cause nausea and vomiting, but we do have some newer anti-nausea medicines that we normally use that we give prior to a chemo, but we also prescribe to the patient so they can use it while on the regimen so they can minimize some of the side effects. We can also actually do some things also to minimize the risk of infection and fever. As a matter of fact, most of my patients that are in chemo can actually work, and they actually work during chemotherapy.
Temporary hair loss is a side effect of most chemotherapy regimens. As hair loss is often the most visible sign of undergoing cancer, some survivors view hair loss as a proud badge of survivorship.
I shaved it before it started falling out, and because I wanted to be in control of that part of it. And once I shaved it, I realized that there was a different beauty, in me, and as well as in any woman.
I shaved my hair off. I wore it bald and went to the Jazz Fest, went all out and open. I'm like, this is me. This is all natural. I'm going to wear my hair balls.
After treatment, cancer patients will need continuous follow-up for several years. It's a good idea to request your own copies of your medical records. Linnell learned that lesson after Hurricane Katrina uprooted her from New Orleans.
It took me like about 2 years to get my medical records because a lot of my records got messed up in the storm. Whenever it's something like a disaster come, like a hurricane or a storm, or even could be an earthquake, whatever, make sure you always keep like a little file box with all your personal insurance papers as well as your doctor's papers, because you never know if you ever actually move somewhere else or relocate somewhere else. You have to worry about having a hard time like I did going 2 years to just get medical records, and it was really rough. So sometimes, it took a long time because a lot of the records were messed up into the system or whatever. The system was down. So it's very important that you always keep your, like a little mini file cabinet with all your medical, especially major medical records in your file cabinet at all times.
If you have surgery to get rid of breast cancer, will the cancer spread throughout your body? Well, the answer to that is definitely no. In fact, that whole thing is a myth, isn't it, Jenny?
That's correct, Cynthia. That is a myth. And in fact, there are many myths surrounding the diagnosis of breast cancer. One of the myths is the fact that if you have breast cancer, you automatically die. And that is a myth. As you can see, I'm still here. There are many, many women who have survived a diagnosis of breast cancer through early detection as well as appropriate treatment.
So let's go ahead and clear up some of those other breast cancer myths. I heard if no one in your family had cancer, you won't get cancer.
Okay, it's very important to know that not having a family history of breast cancer does not protect you, because 75% of women with breast cancer have no family history.
I've heard that cancer feeds off of caffeine.
Caffeine increases your risk of cysts, and I describe cysts to my patients as balloons filled with water. So they can cause cyst growth. They can also lead to breast pain. So that if you're having breast pain, and then I would recommend that you decrease your caffeine or eliminate caffeine consumption and see if that helps.
I heard that deodorant causes breast cancer.
No, we don't have any data that deodorant causes breast cancer. Deodorant can be seen on the mammogram, especially some deodorants are made out of aluminum products or metallic products. And so on the day of the mammogram, we don't want the women to have the deodorant, because those little pieces of metal or aluminum can look like calcifications. So that's why we don't like deodorant on the day of the mammogram.
I heard that an underwire bra causes breast cancer.
It does not. And some say that that all that pressure on the breast, it does not seem to increase any risk of breast cancer. No study has shown that.
I heard if your breasts are small, you can't get breast cancer.
We see breast cancer in women with small breasts, the same as women with large breasts. It's more difficult to find lumps in larger breast women if they're deep in the breast, but you see it in all women.
I heard once you get treatment, your hair will never grow back.
It does grow back after chemotherapy, although some people will say that it comes back with a different texture. So some straight may be going curly or vice versa. So it does grow back, but it may feel a little different.
I heard that a mammogram can actually cause cancer due to the radiation.
In general, our feeling is that radiation from mammography in low dose at appropriate intervals does not cause cancer.
The good news is that the radiation exposure on mammograms today is much less than they were in the past, even though the mammograms are much better, much clearer, but there's less radiation exposure. But don't let that prevent you from getting your mammogram. It's not that much. Remember, if you travel in an airplane across country, you get radiation exposure.
You've heard now some of the myths about causes of cancer. Well, let's talk now about being proactive, how you can actually decrease your chances of getting breast cancer.
And let's also talk about how to live healthier after a diagnosis of breast cancer.
There's a major problem with obesity in the United States, and that has shown to be a risk factor. Hormone replacement has been also known to be a risk factor. Other activities, lack of exercise, the type of diet that we have. So there's a lot of epidemiological data suggesting that most of our cancers, including breast cancers, are related to environment, diet, and lifestyles.
So I cook with a lot of olive oil, and I use a lot of different spices like they use on the cooking channel.
Lucy Joseph is leading a much healthier lifestyle now after being diagnosed with breast cancer. She exercises regularly.
I've changed my eating habits, so I don't cook with vegetable oil anymore. I cook with olive oil. I work out more than I did before. Just try to do the next right thing. I diet and exercise.
And Linnell, who has fought cancer 3 times, is also living healthier.
So far, it's been 7 years now, and every time I get my blood work, I always have great news. And they say, whatever you're doing, Linnell, continue doing what you're doing. So I eat healthy, a lot of fish, take a lot of vitamins, a lot of greens and broccolis and spinach. I eat very, very healthy, and I exercise a whole lot too. So that helps a lot too, in me keeping my body's in shape. So, but yeah, the doctors are really amazed.
And most studies have actually shown that those patients who who are breast cancer survivors, who are usually leaner, who exercise the most, and eat more fruits and vegetables, tend to have a better outcome. They tend to have a greater survival compared to those patients who do not.
Food, to me, is the way and the only way that you can actually build a strong system and keep it that way.
Dr. Jamie Summerfield is a naturopath, herbalist, and certified nutrition consultant.
What we've done and what I do on the post-cancer people is reminding them what their diet was to begin with and encouraging them to change it lifelong. So more implementations of fresh fruits, fresh vegetables, fresh meat, and less packaged food of all kinds, where you're getting fresh things that don't have preservatives.
Dr. Bennett sees Dr. Summerfield on a regular basis to help stay well after cancer. This is one of the techniques utilized by Dr. Summerfield.
It's a very advanced tool to looking into the body to see what is there you don't know that's there.
On this visit, the machine revealed the supplements Dr. Bennett needs.
Get a little something for your thyroid so you feel better, give you a little bit more energy, thoughtful clearing.
And Dr. Bennett reinforces all of that by purchasing fresh organic grocery items, a variety of produce.
The spinach has a lot of iron, and also oftentimes my body does like iron. So I want to buy the spinach that will also help build me up and make sure that I maintain the content level of iron.
Whole grains and salmon.
And I'm purchasing coho salmon because it has more omega-3s. It's a wild salmon versus salmon that you normally buy in a store. So you really want to try to find a salmon that is wild because it maintains its flavor. You can see the color is very different because this probably is farm raised, but this is the wild caught.
And good nutrition and exercise go hand in hand. This kind of information is a component of the breast cancer support group founded by Dr. Bennett, Reconstruction of a Survivor.
It's a wonderful opportunity where you can come and you can kind of get loved on by fellow sisters who've either gone through it or maybe they have a family member that's gone through it.
It's all about celebrating life after breast cancer.
Must be God has a purpose and a plan for me, because sometimes I'll be like in the shock, like, wow, I'm still here. Here's some people that died from the first time of cancer here. I've experienced it 3 times, and I'm still here, still standing. Mm-hmm. Yes.
I'm proud, very proud to be a survivor.
And as you just saw, Dr. Bennett started Reconstruction of a Survivor, which is an awesome organization. And Dr. Bennett, just how does it help survivors?
Reconstruction of a Survivor helps women who have been diagnosed with breast cancer to see that there's hope and there's healing after a diagnosis of breast cancer through faith-driven support group sessions.
And if anyone wants to get involved?
If anyone wants to get involved, they can check the website out at www.roasurvivor.org.
That'll do it for the program. But if you'd like any additional information on any of the health experts that you saw in the show or any of the advice, feel free again to log on to the website that is at the bottom of your screen. I'm Cynthia Nickerson.
And I'm Dr. Jenny Bennett. We thank you for joining us today. Remember, the information that we shared in the message today may save your life or the life of someone you know.
Thanks so much for watching. In Texas, the Breast and Cervical Cancer Program, or BCCS, offers clinical breast exams, mammograms, pelvic exams, and Pap tests, free or low cost to eligible women. There is also Medicaid for breast and cervical cancer treatment for eligible women. For more information about these programs, find a link to the website by logging on to roasurvivor.org.